if your healthcare system isn't speaking about environmental justice, how can we feel that they really care about people? Because we know all the patients you have coming in with respiratory issues, cancer, asthma, all the different health implications. If we know there's a direct correlation between what's happening in our environment with the pollution, with the water we drink, the air we breathe, the soil that the food we grow comes out of. If we know that for a fact, if we as the health industry aren't the main ones sounding the alarm, then someone could say we're complicit in that because that's driving business. And that's a terrible way to look at it. So if you're quiet, that means you can fall into the category of those who only care about money and who are okay with what's happening in the environment because that's driving more business. But that can't be a good way to live. There's no way we can come from the history that we have in this country of exploitation and fulfillment and enrichment on the backs of other people to still be okay with these environmental concerns that we have today. So I'm not going to speak too long because I understand that, we're a little bit over time, but I just want to make it very clear that the healthcare system has a huge responsibility in the environmental and in the climate change movement, and not just because of how many emissions that come from healthcare systems. That's not even it. And of course, we know our hospitals running 24 hours, all the different processes, the machinery. It's a huge producer of carbon, and we know the low-hanging fruit is there's more that we need to do in terms of our practices to reduce our emissions. That's the low-hanging fruit. But the major thing we have to focus on is what are we going to do in terms of being a voice in our communities, fighting for legislation that lowers emissions, fighting for legislation and practices that ensures that there's more equity in our environment. Because at the end of the day, if we're not working to improve the systems, every time you heal someone, they're going to be back. So what does that say about the oath you taking to try to help people if you're sending people right back into the polluted world and you're not fighting to fix the polluted world? So this is really important to me. I speak often with universities, high schools, also medical centers. And the point I'm trying to drive home all the time is that until everyone takes a serious look at themselves, nothing is going to change for our planet. And I mean all of us recognizing that the same people who are low income, accessibility issues, transportation issues, these are the same ones who have the access because they live in these red line communities, which was already mentioned, and they have exposure to the pollution that's causing all of their ailments. These are the people who's coming into your office every day. And if we don't have first an understanding about many of these reasons aren't their fault. Yeah, there may be some eating habits. Yeah, there may be some choices that impact their health, but breathing isn't their fault. They have to breathe. Eating isn't their fault. They have to eat. So if we're not talking about those aspects and the implications on their health, then we're really not doing what we're supposed to do.